Raylan, and I'm going to talk to you about STIs in pregnancy, specifically gonorrhea and chlamydia.
Hi, I'm Sarah, and I'm going to be going over risk factors and complications.
Hi, my name is Ethan. I'm going to be going over procedures and medications.
Hi, I'm Maria. I'm going to be going over the nursing interventions.
All right, to start off, I'm going to first talk to you about STIs. So STIs are also known as sexually transmitted infections, are very common but preventable. According to the CDC in 2024, a sexually transmitted infection, also known as an STI, is a virus, bacteria, fungus, or parasite people could get through sexual contact. Chlamydia and gonorrhea are both bacterial infections, and in 2025, the CDC goes into more detail about these infections. Both chlamydia and gonorrhea are common STIs that can cause permanent damage to the woman's reproductive system. This can make it even difficult or impossible to get pregnant later. I'm going to pass the phone to Sarah to talk to you about risk factors and complications.
You may be at a higher risk if you have a history of STIs, have multiple sexual partners, or are not using protection like condoms. Being younger, specifically under the age of 25, also increases your risk, which is why routine prenatal STI screenings are so important to protect both you and the baby. Without treatment, these infections can cause serious complications for both mom and the baby. According to ATI in 2022, it says you could experience complications like preterm labor, where your water breaks too early and your baby is born before 37 weeks. And in mom, it can lead to serious complications like blood infections or inflammation of fallopian tubes, and most often can cause pelvic inflammatory disease, where an infection spreads up from your vagina to your uterus, fallopian tubes, and ovaries, which could later on lead to infertility. If the infection passes to the baby, it could restrict the baby's growth while inside the womb and cause serious infections in the blood and lungs like sepsis and pneumonia, and even an infection in the eyes, which could lead to blindness. Now let's talk to Ethan about diagnostic procedures and treatments.
So how do you diagnose gonorrhea and chlamydia, and how do you treat it? So diagnostic testing for gonorrhea and chlamydia involves a first stream urine sample. It's a test called nucleic acid amplification test, or NAAT, and it's more sensitive to those types of infections. More recently in 2019, the FDA approved of a throat and extragenital swab. So that's similar to a type of NAAT diagnostic procedure. So anyone who's contracted chlamydia or gonorrhea must be treated, neither of them go away on their own, and they must be treated with antibiotics. Chlamydia is typically treated with doxycycline 100 milligrams twice daily for 7 days, and then gonorrhea is treated with a singular intramuscular shot of ceftriaxone 500 milligrams. So in a study from the American Journal of Emergency Medicine that came out in July of 2024, non-adherent patients or patients who didn't pick up their prescription or did not follow it, who were discharged from the ED, were most likely to go back to the emergency department with the same cheek complaint and symptoms within 4 weeks. So what's the role of the nurse in medication administration for chlamydia and gonorrhea patients? So first off, nurses should assess allergies and teaching the importance of completing the full course of medication and provide clear instructions for follow-up testings if the symptoms persist. If patients do have allergic reactions, there are alternatives including azithromycin and erythromycin, which are both antibiotics. So the management of both chlamydia and gonorrhea requires some follow-up after you're treated. Non-pregnant patients should retest for infection after 3 months or 1 year after completing the treatment. Retesting for pregnant patients should be done 4 weeks after treatment.
Thanks, Ethan, for that information. All right, so let's get into the nursing interventions. Chlamydia and gonorrhea are both preventable and treatable infections, and nurses play a vital role in patient education, prevention, and follow-up care. A helpful mnemonic when building a framework for a sexual health history are the 5 Ps, but not to be confused with the 5 Ps of compartment syndrome. So, an article from 2023 titled Improving Chlamydia Risk Screening by Using the CDC's 5 Ps Approach to Sexual Health History by authors Gautam and Arino. They stated the 5 Ps are partners, practices, protection from STIs, past history of STIs, and pregnancy intention. So what do we ask as a nurse? So let's ask those questions. We need to ask about the type of sexual contact. We need to remember what Sarah said. It can be vaginal, oral, or anal. We need to ask how many sexual partners have they had? What were their genders? Ask about protection. Are they using condoms? Are they using any other barrier methods? History time. Ask about a past history of STI. And lastly, pregnancy intention. Discuss if the patient's desire to have children and whether they are using contraception to prevent any pregnancy. Okay, now we are going to deep dive into nursing interventions. Nursing interventions are so important, and we need to be educated on how to intervene. First, one of the most important nursing interventions is screening and early detection. In 2021, the CDC released guidelines that recommends annual screening for all sexually active women under age 25 and for older women with new or multiple partners. Nurses should ensure that screening is offered routinely during reproductive health visits, prenatal care, or family planning appointments. 2. Providing education is essential. Another guideline from the CDC was released in 2021 that discusses the importance of patient education. Nurses should teach patients that consistent condom use, reducing the number of sexual partners, and maintaining open communication with partners significantly lowers the risk of infection. For those who test positive, it's important to explain that both the patient and their partner must complete treatment and avoid sexual activity for 7 days after the last dose of antibiotics. Remember what Ethan said. All right, number 3. Nurses should promote family-centered and non-judgmental care. According to a chapter from the book titled Case Management for People with STIs by the World Health Organization, publicized from the NIH, National Institutes of Health, building rapport and making a patient feel comfortable is so important in a circumstance where they may feel shameful or worried. Creating a safe environment where patients feel comfortable discussing sexual health helps reduce stigma and encourages honesty. Nurses can advocate for confidentiality and emphasize that seeking care early prevents long-term complications such as pelvic inflammatory disease, infertility, and neonatal infections. Finally, nurses should collaborate with public health departments for partner notification and contact tracing, which is a key part of breaking the infection cycle within communities. Overall, nursing interventions for chlamydia and gonorrhea focus on early detection, education, treatment adherence, and compassionate care, which are essential in promoting patient safety and preventing infection.
Ayo, knowledge check.
We're going to go through 6 questions. You have 5 seconds to answer each question. Some questions are tricky though, so make sure to pause if you need more time. Question 1. How do you get an STI? A. Oral sex. B. Anal sex. C. Vaginal sex. Or D. All of the above. If you picked C. Vaginal sex, you're wrong. The correct answer here is D. All of the above. Any type of sexual activity that involves contact with a partner's bodily fluid or infected skin can spread STIs. Question 2. True or false? Birth control pills protect you from STIs. The correct answer here is false. Birth control pills don't protect you from STIs. They can help prevent pregnancies, but the real answer here would be a barrier method, such as a condom or a dental dam. Next question. What serious complication can untreated infections cause in a mom and can lead to infertility? A. Urinary tract infection. B. Pelvic inflammatory disease. C. Constipation. Or D. Hypertension. The correct answer here is B. Pelvic inflammatory disease. If you didn't get this right, I recommend going back in the video and watching the part about serious complications. Question 4. True or false? A pregnant person with an STI can pass the infection to their baby. The answer here is true. Both gonorrhea and chlamydia can be passed to the baby during childbirth. This is why it's important to not just remember that STIs hurt the mother, but they also can potentially hurt the baby. Question number 5. Which factor increases a person's risk for STIs during pregnancy? A. Being over the age of 30. B. Using condoms consistently. C. Having multiple sex partners. Or D. Having only one sex partner. The correct answer here is C, having multiple sexual partners. Make sure to go back at the risk factors part of this video to see if you are at risk. Last and final question. This one's a tough one, so pay attention. Let's select all that apply. What are the 5 P's of STI? Partners, position, pain, past history, protection, practices, pulse, pregnancy intention, and polyuria. The correct answers are partners, past history of STIs, protections against STIs, practices, and pregnancy intention. Let me know if you got that right. Thank you guys for watching. We hope this video was helpful.